Good Tuesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer of the Knox County Health Department. In honor of World AIDS Day, our moment of gratitude today is dedicated to those individuals who are committed to ending the HIV epidemic and supporting those who are fighting this battle. A special shout out goes to our Centers of Excellence Clinic at KCHD, where our staff provides care to those living with HIV. Thank you for your commitment to this important cause. I'd now like to spend a few minutes talking about contact tracing and provide a timeline to show how the process unfolds. Over the last several weeks, when discussing our public health capability benchmark, we have repeatedly stated that the challenges that we are facing due to the high volume of cases we are receiving daily. The ability to initiate case investigations and begin contact tracing in a timely manner diminishes as the volume of cases increases. There are several reasons for this. First of all, we don't have an infinite number of team members who can surge up as quickly as the cases have. Second, with a high volume of cases, the lab turnaround time can increase, delaying when we are notified of positive cases. Additionally, the reporting system can have challenges in managing the high volume of data that it is receiving daily. So let's walk through a little scenario. So we've got this person, let's call him John. He starts feeling badly on Tuesday, but he waits a few days to see if it's a cold or allergies. But when his symptoms don't go away, he decides to get tested for COVID on Thursday. Currently, the results can take an average of 3 to 5 days to process. Let's say his results were back in 4 days and the clinic where John was tested is notified by the lab of his positive result on Monday, and they also notify John. The clinic and the lab have 24 hours per state law to report the positive to public health. And that can be directly to us or most often to the State Department of Health, which they do on Tuesday. So our goal is to initiate a case investigation within 24 hours of receiving notification of this positive report. Therefore, public health staff contact John on Wednesday, almost 1 week after he was tested. As you can see, even when the process runs relatively smoothly, there are many partners involved and it can take time. Now, consider the fact that we are receiving upwards of 200 to 300 new cases a day, or more than 400 like we are reporting today. Performing contact tracing during widespread community transmission like we have now is not as effective as it was earlier in this pandemic or as it is when we are managing a traditional outbreak. Because of this, we are reviewing our contact tracing strategy with our team to identify ways we can best prioritize this process. As a result, we will modify our contact tracing efforts as the pandemic progresses. We're using guidance from the CDC, the Tennessee Department of Health to identify how to use our resources as strategically as possible, which is critical as our team prepares for vaccine distribution. Contact tracing is a highly effective tool in our toolbox, but it does have its limitations, especially in a pandemic. That's why it's important for individuals to take personal responsibility and isolate themselves at the first sign of exposure or symptoms. Think back to our previous scenario. If John had waited until he heard about his positive result to isolate, he would have been waiting more than a week after he developed symptoms. If he resumed his daily activities, he could have spread COVID-19 to his friends, family, and coworkers. The situation we provided was with things working as they should. However, sometimes with the volume of cases we are seeing and the challenges with accurate and timely reporting to public health, or in the reporting system itself, there are times when an individual is made aware of the results before we in public health know they're positive. In these cases, it's imperative that individuals take proper precautions to isolate and notify close contacts that they need to quarantine. It's a crucial part of our response is community responsibility. Additionally, anyone who gets tested for COVID, regardless of symptoms, needs to isolate until their results come back. A helpful tool when determining your isolation or quarantine period can be found on our website. just go to our main COVID page at covid.knoxcountytn.gov. Okay, and click additional COVID-19 resources. I thought there was more to that. Sorry, and then quarantine and the quarantine and isolation calculator. This will take you to the Tennessee Department of Health webpage, where you can input your date, the date of your symptoms again, the date of your test, or the date you were exposed, to determine when your isolation or quarantine period is over. If you do these things, not only are you breaking the chain of transmission, but you're lessening the dependence on contact tracing process because you are effectively doing it yourself by isolating yourself and calling your close contacts. To all the medical providers who may be watching, it's also critical for you and your team members to encourage patients to isolate or quarantine. As you are for so many illnesses, you continue to be a critical source for guidance for our community. As our case count continues to rise and the response naturally evolves, taking personal responsibility will become even more important. You know what you need to do to stop the spread of COVID-19. We've been talking about it for months. Please follow the guidance we outlined today, and as always, continue to practice the 5 core actions. As a reminder, the Knox County Board of Health will meet via Zoom at 5 p.m. Tomorrow, Wednesday. There will be an opportunity for public forum at this meeting. Those who want to register for public forum can call the mayor's office and provide the necessary information. More information is available on the Board of Health webpage. You may stream the meeting live on community television, the Knox County YouTube page, or the Knox County website. Well, now we'll look at the local situation. We have 437 new confirmed cases since yesterday's report. This is our largest daily increase since the pandemic began, giving us 18,938 confirmed cases of COVID since March. Additionally, we have 1,088 probable cases. 17,276 of our cases are considered inactive, giving us 2,578 active cases. 593 individuals have been hospitalized at some point in their illness, and currently we have 129 Knox County residents hospitalized. And sadly, we have 5 additional deaths to report today, raising our total to 172. So now I'll open up for questions.
All right, the first question we have is from Brian Hornback. He says, on the television news last night, there was a line outside the health department to be tested for COVID. Are the numbers of COVID testing up?
Our numbers at the health department are up. I think the report I got for yesterday was around 400 people were tested by us yesterday. So that's more than we had been doing, yes.
From Jeff with WATE, why so many new cases today? Are there any specific events, methodology, or statistical changes that you can point to?
Well, I think it speaks to several things. One, it speaks to just the sheer burden of disease of COVID-19 in our community. That's one thing. These are real cases, regardless of when they were tested or anything. These are people in our community who have COVID. It is probably also related to some of the challenges we've spoken about of the reporting system and delays in getting test results back. So that's contributing to it. But again, doesn't take anything away from the fact that we have 473 new cases.
From Megan with WBLT, is today's spike in cases correlated at all with the Thanksgiving holiday?
It's a little bit early for us to see a result from Thanksgiving interactions. But we think it might be resulted from all the people that got tested before they went to Thanksgiving. And we're hoping those people didn't go home and share the joy with their families while they were waiting for their test results to come back.
From Vincent with the Sentinel, it looks like the majority of these new cases were identified from specimens collected just prior to Thanksgiving, which means that we haven't yet seen the impact of the holiday on COVID. Do you have any comment on this?
I think that's what I just said, but yes, I agree. We believe these are probably specimens that were collected prior to Thanksgiving. Thanksgiving was last Thursday. Incubation period for COVID is 2 to 14 days. Most people start feeling ill 5 to 7 days. So we're getting close to that time frame, but we shouldn't be seeing those cases yet. Like John, they probably won't get tested the first day they feel sick.
From Grace with WBIR, how many people have you tested the last 2 days, and what do lines look like and turnaround time?
Grace, we'll have to get back to you with that. I don't have those exact numbers off the top of my head. But the longest wait is about an hour, and times it's shorter, but it's about an hour.
Turnaround time in the community is about 3 to 5 days.
Yeah, sorry, skip that part. Turnaround time is 3 to 5 days. Our turnaround time is a little bit shorter, but that could go up as we test more people.
She also asks, how is your staff handling the demand?
Our staff is tired and frustrated. Just imagine as frustrated and tired you are, as all of you out there are, of COVID-19. We've been living, breathing, eating COVID-19 for 10 months, working really hard, doing really hard work, and accomplishing a lot. Our contact tracing and all the work we did helped slow things down, bought us some time so hospitals could get prepared, so other things could get in place. And so, we're still doing that, but we're really, it's really challenging to continue to work at that level. And we've really increased our testing. Our testing team is working very regularly, doing events in the communities. And that same team has also been doing those flu vaccine clinics. So it's a very busy time for us. Our phone bank folks are listening to people who are, calling with questions, or people who are not happy. People don't call the phone bank generally to say, hey, thanks a lot. They generally call to say, I have a question or I have a complaint. So there's a lot going on, and we're doing a lot. And our team is fatigued. We're bringing on more staff, but we have to train those staff to be able to do the job. And with the numbers going up, we're really unable to pull our staff out of the response because the numbers are so high. Again, a reason why we're reevaluating how we do what we do.
Also from Grace with WBIR, by our count, new cases, current hospitalizations, and active cases all hit record highs today. What's your response to that?
I think what we talked about today is really putting it back on the community to slow this steady climb. Practicing the 5 core actions. When you think you might have COVID, or maybe you were contact to a case, you need to isolate yourself or quarantine yourself and stay home and not expose other people. If you've been tested, no matter the reason you've been tested, you need to quarantine until you get those test results back. So it's really up to all of us to practice all of those things every day, all the time, in order to reduce the numbers. And anybody who's been in this community or in this country for 2020 knows what to do. You know what to do. Staying home if you're sick, washing your hands, wearing a face covering, social distancing or physical distancing from others. Those things are all really important, and not taking your guard down, even just because you're at a table with familiar faces.
Vincent with the Sentinel, since the impact of Thanksgiving isn't visible yet, what do you foresee happening this week and early next week?
I think the cases will go up. And it's really up to the community to decide what that trajectory is. Does it continue to go up, or does it go up and, slow down? That is really up to the community. We want to educate you and give you the tools you need to protect yourself and your families, and we've done that. It's out there, it's on our website, it's anywhere and everywhere. You just need to heed our advice.
From Jeff with WATE, what will contact tracing now look like after these changes to resource allocation you just mentioned?
Well, we don't know yet. We're just brainstorming with our team to kind of try to figure that out. They know the process and they know the trends better than we do in leadership. So we're relying on their expertise and experience to help frame what that looks like next.
From Grace with WBIR, you talked about the challenges of contact tracing and timely reporting. Is there a point where the volume of cases becomes so high that timely contact tracing is impossible? And when is that breaking point?
Certainly, there is a time. We're very near that. And a lot of the regions around us and other counties in the state are there. They're not able to contact trace in a timely fashion because of the sheer volume. So there is a time, and what we'll do is I think we'll do targeted and strategic changes to how we do that so that we can have the most impact to those most at risk of spreading disease or becoming seriously ill.
From Vincent with the Sentinel, I know Dr. Buchanan can't speak for the Board of Health, but the recent agenda the Board of Health sent out yesterday includes a link to a proposed social gathering limitation that is faulty. Can you provide a working link to this resolution?
Oh, sorry about that. Yep, we'll have to follow up on that. Thanks for telling us.
Yes, the link right now is not it doesn't go to anything right now. It will be sent out, and we'll update that once that resolution has been finalized and is sent out to the Board of Health. From Megan with WBLT, Vanderbilt University Medical Center has decided to delay non-emergency procedures due to the recent spike in cases and a projected spike due to the holidays. Have any hospitals in the Knox County hospital system expressed any consideration about making a similar decision?
As we've said many, many times, our hospitals coordinate and collaborate. They're meeting almost daily, if not daily, to make those decisions. And those are great questions for them. Those decisions will come from them. They know their operations. They know what they need to do much better than we do.
Also, as a follow-up from Megan, does the data show projections for a future spike in Knox County? And if so, when can we expect a peak?
So I'm not sure.
I'm not sure. You mean hospitalization or just a case increase? If you can kind of specify what you were looking for, that'd be helpful. For Vincent with the Sentinel, when you report turnaround time, can you please report the full range and the median turnaround times for COVID-19 tests? The average seems like it's concealing the upper wait times. We have heard from people who have waited more than 7 days.
Charity's going to answer that question.
So we can talk about what we report out, and you're absolutely correct. There are people that are waiting more than 7 days. Absolutely. The average is there, but there's also a large portion of people that get their results back same day. And so that's why we are looking at that's why we report the average out, is just because of that. But Vincent, we'll talk about that and see if there's a way that we can make it more clear in what we're providing. But just know that, yes, while there is absolutely people that are waiting a very long time, there's also people that get it in the same day as well. So there is a balance there still.
Another question from Vincent with the Sentinel. We have been hearing about individual responsibility for months now, but there have been few policy changes at the state or local level that would help individuals ameliorate the spread of COVID-19. What is the missing piece, and what do you want to see happen?
Just what we said earlier, people need to practice the 5 core actions all the time, isolate and quarantine when appropriate, and get tested if they're concerned they might have COVID. We really public health relies on the public to do what we ask them to do all the time. This is really more important than ever now. There's really not a lot of tolerance out there among the community and businesses and leadership for more regulation. And right now it's a time for people that, all those folks who are all about personal responsibility and all of those things. Now's the time for you to step up and do those things and protect your community. It's for the good of all. It's really about doing the right thing, the right thing to protect your community. It's not a left or a right political thing. It's just the right thing to do right now for our community to reduce spread.
From Brian Hornback, not specifics, but have you seen individuals that tested positive for COVID and now after 90 days or more, they have tested positive again?
Do you want to talk? Okay.
Sorry. The answer is yes, we do see that and expect that to happen more and more. And so the protocol at this point, as we take a really close dive and really look at the cases when they do come back at over 90 days and look to see if there's been any additional or new exposures. Are they symptomatic again? Or are they not? All of those things get taken into consideration. And then we actually have a discussion with Dr. Buchanan and the State Department of Health on whether or not to consider that a new infection and isolate again and quarantine based on that. At this point, again, it's really those come by case basis, and we continue to evaluate each one of those until additional guidance comes out from the state and federal government.
From David with WVLT, do you know the number of vaccines Knox County is expecting in the first wave?
No, we don't. The vaccine situation changes at least daily, if not more often than that. So we'll share information as we have it. It comes down from the CDC to the state to us. And so as we know more about that, what we do know is what we believe, nothing's written in stone with vaccine yet, that we will be allotted vaccine based on our population and potentially allotted vaccine based on the numbers of people in those first tiers of people that are to be vaccinated, the tier one and like tier one folks within that group, based on how many of those people live in Knox County. The state is using various databases to gather that information. That is what we believe will happen. But we won't know for sure how much we're getting until we have it and we see it and count it.
From Megan with WVLT, this was based on her previous question. She said she was speaking about case counts and hospitalizations as Vanderbilt doctors cited a data projection and their decision to limit hospital procedures. So her original question, I'm scrolling up, was does the data show projections for a future spike in Knox County, and when can we expect a peak?
So, well, we don't know when we hit the peak until we start going down again. So that's totally unknown. When will we hit our peak and start to go back down? We don't know that. But what we do know, looking back historically, and we've shared this data with you all, about 2 weeks, 10 days to 2 weeks after a holiday, starting way back with, if anybody remembers, Memorial Day, I believe, we see a peak in cases. The challenge where we are now is we had I keep wanting to call Halloween, Thanksgiving. We had Halloween, we had a spike from that. And then we had Thanksgiving, we hadn't come down from the spike from Halloween. So we're going to spike again after Thanksgiving. And then we have Christmas and we're going to spike after that. And we have New Year's, spike after that. So we really are very concerned about that trend. And I want to say back to our community, we can all make a difference in this if we just follow the 5 core actions religiously. And no matter where you are, if you're not with people in your household, it's not hard and they're not hard to follow. So it's really a plea to our community to follow those 5 core actions.
Jeff with WATE, any curfew enforcement actions over the holiday weekend?
I don't have that information. I'm not aware of any. Actually, that would be a great question for Knox County, not Knox County, Knoxville Police Department. They're the ones doing enforcement actions.
From Grace with WBIR, looking back on November, it seems like a lot changed in terms of the local COVID situation. Mm-hmm. Can you speak to that at all?
Well, I think I just did, but it's really about the change, and the holiday season starts kind of with Halloween and kind of continues throughout. Kids went back to school, UT came back in session, people are going inside, we're not outside as much, so we're sharing more air indoors, which is a higher risk activity than being outside. So all of those things combine to make us see more cases.
Also from Grace with WBIR, on a scale of 1 to 10, how concerned should Knox County residents be about the virus going forward? Please give a number and explain.
Well, I think, we have the highest case count we've ever had in Knox County. So I would put concern at a 9 or a 10. I'm just being really honest. It's just going to continue to go up, and it really is in your hands and all of our hands to make a difference in the trajectory. And what's that mean? That means Christmas is probably going to have to look different than it normally does. We just discussed today, we normally have a big holiday potluck for our staff. Well, we're not doing that this year. So how can we share some Christmas joy or holiday joy with our staff who are working really hard this year? We're going to have to be creative and come up with ideas about how to do that. And I encourage you to do the same with your families, with your friends. How can you creatively celebrate the holiday season in a meaningful way that's also safe and doesn't increase risk for those you care about?
Vincent with the Sentinel, how has the mood shifted inside the staff of the health department?
I think our staff are really dedicated and they really believe in what they're doing. But they're frustrated. And I think, it's winter is upon us and days are shorter and we're still working hard. So I think we have some folks who, honestly, I have some challenges. We've done some things to try to address those in little ways. We've had different things happen and done different things to help our staff. We reinstituted something that our staff has traditionally enjoyed. We have a monthly in-service where everybody comes together and hears from leadership and learns about things. So we've reinstituted that. We're doing it virtually. Everybody's going to be able to get on a Zoom and hear announcements and celebrate birthdays and celebrate accomplishments and celebrate each other. But we're doing it virtually. People will be doing it from their desk, or if they're working from home. We won't be bringing them into the auditorium. So we're having to be creative to keep get that camaraderie back with our entire staff.
Also from Vincent with the Sentinel, when I asked about additional policy, I was not asking specifically about new regulations. There's a difference between supporting people so they can isolate and stay home and punishing people for rule infractions. What other policies would you like to see implemented that would make it easy to follow the 5 core actions?
I actually haven't thought about that. Not really sure. Charity's writing. It's something we haven't talked about in a really long time. So one thing that we could see that we'd like to see to support people to follow the 5 core actions, in particular, staying home if you're sick or having to isolate or quarantine, is employers looking at their leave policies and allowing that to happen. Not punishing their employees because they're in quarantine or because they're sick. And to look at their leave policies and make sure they allow for people to be able to stay home and continue to earn a paycheck. And also social support, being kind to one another, respectful of each other, respectful of space, respectful of if somebody decides not to wear a mask, respectful of that. If somebody does wear a mask, respectful of that as well. And also, honestly respecting our team. When they call and tell you that you have COVID, listen to them and take their advice and cooperate. A lot of people do, but some people still don't. So that's one way you can support our team as well.
From Brian Harback, this question is for Charity. Are those infections that are multiple occurrences at a percentage level yet? 10%, 40%? Is it a number large enough for community concern?
Probably not at this point. We'd have to go back and look at that. It's happening more frequently, but it's not a huge chunk at all of the percentage of what we're seeing. But I do expect as our case numbers grow now, and we have more disease in the community, that's going to continue to go up. And so that's why we're waiting on, and everybody's looking very detailed at this from Department of Health and CDC on how we move forward in this new realm as our case counts are going up and that type of thing. But it's still a very small percentage that we run into with that situation at this point.
All right, I'm not seeing any other questions in, and since we're right at close to 1 o'clock, that looks like it'll be it for today. So thank you all for your time, and we will be back with you again on Thursday at 12:30. Have a good rest of your day.